Saying hello from Vienna, Austria. And so I will be speaking about two countries that I've worked in a lot because Austria really is very backward in integrated care. So I wanted to zoom out, first of all, because obviously integrated care has been going on for a long year. And 2 years ago, we asked some of our key contributors to the International Journal for Integrated Care and the Foundation to actually reflect in their own home countries on what has happened over the last decade. And also to answer some of the questions that I've seen in the chat, how much guidance do you need on the policy level and how much needs to come from the bottom up? I think what we really saw in this comparison was that it doesn't seem to matter really, because when you compare countries like the Netherlands or Australia and New Zealand, where there have been maybe 1 to 3 to 5 policy reforms over a 10-year period, while in Canada, with all your different provinces and regions, you've had hundreds of policy papers, strategies, reforms, frameworks going on. The outcome really seems to be very similar in that, yes, we're moving 1 step forward and maybe 2 steps back, but this chasm between policy and practice is still something that all of us are struggling with. And it's a really good example when we take the Netherlands, who's been one of the innovators over the past 20 years, definitely. And a lot has been going on, even though they only had 3 reforms really over the past 20 years. There is a strong commitment throughout the health and care system, throughout actually also government, that health, positive health, population health management, social determinants of health are really on the top of the agenda, which is really quite special compared to other countries. So there is a big awareness that we need to shift the focus from disease to health, and also then shift the way we organize systems and also organize processes. There's also been a lot going on, as also Stephanie pointed out, in trying out different funding models, bundled payments, etc. And a lot of knowledge has been acquired. One of the key learnings from the Netherlands is that they've always managed to actually evaluate everything they did. They are very thorough in analyzing, in learning lessons, and then also disregarding what hasn't worked and learning from it. But when you ask colleagues from the Netherlands, they will also say, well, actually, we're still a very fragmented system, and integrated care is really still more an aspiration than a fact. 2 really new developments, which are now starting to actually be implemented in practice, are really a case in point. There are 2 policies. One of them is the Integrated Care Agreement, and one is the Healthy and Active Living Agreement. They're seen as 2 parts of the same initiative, but they again show how policy and practice really don't seem to fit together, because these policies, the Integrated Care Agreement, is very much focusing on primary and secondary care and setting up integrated care regions similar to what the England and Scotland have done and what some of the Spanish countries have done as well. They're driven and paid for by the health insurance system mostly. So it's still, even though it's about data sharing, it's about learning from each other and establishing integrated care networks, it's still very much disease driven. While the Healthy and Active Living Agreement is all about prevention, it's all about health promotion, and that is driven by communities and municipalities. So you are building up, you have 2 parallel policies driven by different stakeholders in the system, asking for those different stakeholders to actually work together across both policies, and none of them really knowing what they're doing. And that is really, I think, the case that we can see and learn from, that we see a lot of really good policy and intentions, but then when it actually comes to implementation, there is a real there's a real misunderstanding and a missed opportunity of actually giving the freedom for local initiatives and regions to figure it out for themselves. Usually policies are much too restrictive in actually saying this is what you need to do, rather than saying these are our aims, this is our vision, these are the outcomes we want you to reach, now figure it out for your local communities, for your populations. there's also clearly a huge lack of actual knowledge. What does implementation mean? What does change management mean? And what does it mean on the different levels of the system? It doesn't suffice to say we mandate that a university needs to evaluate and work alongside an implementation strategy. There needs to be really also investment into the knowledge of the implementers on the ground, the frontline workers, but also on the systems level. And so that is something that we found over the past 3 years working in the Netherlands on an implementation model, that really the knowledge on what actually is going on in the system, who are my key players, and how do I actually also bring those people together is really non-existent. And it's one of the key barriers to change for it to actually happen. And then something that has come up now in my conversations with colleagues from the Netherlands, when we were reflecting what are the lessons over the past 5 years in these implementation models that we tried to support as well as academic partners, and where we saw that actually everything that we've told them did not, well, it did happen, but they didn't really listen to what we said the lessons learned from other countries were. So the question really is, why are we so obsessed with transferability and scalability and comparing outcomes when clearly everybody just does what they want to do? And how do we actually get people not only to listen to evidence and lessons from other countries or even other sites, neighboring municipalities, but then actually also acting on it? And I think one of the key questions here is, what is it that people need to learn themselves and experience themselves? And a lot of change and a lot of implementation is just feeling the pain and going through the process. So I would challenge this question also in, yes, we need those policies, but how much can we actually learn from others? And what is it that we need to learn ourselves on the front line? Because finally, what it really is about is that we need people who are humble, who are resilient, who are courageous in really breaking out of those known norms, walls, and processes, and really thinking about a very different kind of system. And that is something that we fight as academics, I think, also face a lot, that it's a challenge to really break out of what we know and think outside of the box, which is very much implementing a learning system. And that is probably one of the key lessons also for policymakers, that we need to move away from mandating and more towards a really implementing learning health systems on a reasonable scale in around regions, around communities, and around populations. And with that, I want to hand back. Thank you.